My name is Jennifer Caldwell. I'm the Director of Nursing at North Mississippi Medical Center Tupelo's Women's Hospital. And today we just wanted to talk about childbirth during the COVID-19 pandemic. You know, if you're pregnant or planning to become pregnant, it's understandable that you might have some questions, some worries about childbirth and labor and delivery during the pandemic. And so we're going to take just a few minutes, answer some questions about COVID-19 and pregnancy. So the best way to protect yourself is to avoid contact with people with the virus. We know that the virus is mostly spread through close contact with those that are infected, whether that's through respiratory droplets when they talk, cough, and sneeze. And so the key is to avoid contact with somebody with the virus. However, the challenge is that you may not always know when someone has the virus. They may be contagious and spreading the virus and not really showing any symptoms. So we encourage you to take precautions in all interactions. We want you to take these 3 simple steps. Maintain a social distance of 6 feet or more. Practice good hand hygiene. And wear a face mask in all interactions. So in the media, you may hear that some women have fear of delivering in a hospital setting just because of fear of exposure to the virus. But the American College of Obstetricians and Gynecologists, along with the Society for Maternal Fetal Medicine, released a statement saying that even in the midst of the pandemic, the hospital setting is still the safest place for women to deliver in the United States. Our nursing staff, administration, leadership here, and along with the physicians have worked closely with our infection control department to make sure that we continue to provide safe care while following all of our infection control guidelines. Here, our environmental services department has worked hard to make sure that our facility is clean and properly disinfected. Our employees are monitored each day. When they come in to report to work, they have their temperature checked. They attest that they have no symptoms of coronavirus prior to starting their shift. And then we require all employees to wear a face mask to protect themselves and others. So as the virus has continued to spread in our state and in our community, we're trying to take extra precautions to make sure that we provide a safe place for our moms and babies to deliver. And so here at Women's, we ask all patients and visitors at the entrance about symptoms for coronavirus, and we check their temperatures. We also provide all patients and visitors a mask and ask them to wear those throughout their stay here at Women's. We also limit visitation to only 1 visitor for each adult patient, and we also limit to just mom and dad or a support person for our babies in the neonatal intensive care unit. By limiting our visitors, we decrease the number of exposures to our patients and our staff. So for all deliveries, vaginal deliveries, and cesarean deliveries, our staff members are wearing additional protective equipment. And so it's during delivery that we think that the respiratory droplets could be spread from person to person. And so at these times, our staff are wearing protective gowns, face shields, and a special mask, and that's for all deliveries. For many years now, we've been encouraging moms to keep their babies in the room, stay together as much as possible, but now during this pandemic, we're encouraging that even more. Keep their babies in the room in to prevent exposures to their healthy newborn. So breast milk is the best choice of nutrition for most babies, and so it prevents against many infections, not just the COVID-19. Researchers are still trying to learn if COVID-19 virus can be spread through the breast milk, but what data we have so far does not show that it is, and so therefore breastfeeding, breast milk is the preferred method for nourishment for most babies when possible. So we realize this is an exciting time for you and your family, and you want to share the birth of your newborn with your friends. Because of limited visitation, we're blessed that we have exterior windows on most of our rooms here at Women's Hospital, and so we provide little place cards for you to put in the window to mark your room and have family and friends visit at your window. You can show off your newborn there. Our IT department has also provided iPads for virtual visits. If you would like to visit with your family through FaceTime, just ask your nurse and they'll provide you with an iPad so you can visit virtually. So if you test positive for coronavirus, we want you to notify your OB. We want you to be able to continue to make your prenatal visits, so we want you to notify the office so that they can make special arrangements for you to continue to get prenatal care. If you need to be seen at Women's Hospital while you're positive for coronavirus, we want you to notify us prior to coming so that we can make special arrangements. You can do that by calling admissions at 377-4920, or you can call NurseLink at 377-3007. And this way we can be prepared for you when you arrive. We have a designated unit at Women's Hospital for our patients with coronavirus. This unit is designed and equipped to provide care for patients needing an OB emergency visit, high-risk prenatal visits, and antepartum stays, labor, delivery, postpartum, and newborn care. So our staff will have a conversation with you. Even the physicians may talk to you about it, about choosing whether or not you want to room in with a newborn after delivery or choose separation. Initially, the recommendations were to separate temporarily from the newborn because we just didn't know a lot about the infection. And so now the AAP, which is the American Academy of Pediatricians, now supports moms rooming in with their newborns. And so moms can choose to keep their baby in their room with them as long as they can maintain a reasonable social distance when possible. Wear a face mask and practice good hand hygiene. While you're here in the hospital, we will provide a closed isolate as opposed to an open crib to add that extra barrier of protection against the respiratory droplets. But if you choose to separate and want to temporarily separate from the newborn until you're feeling better, that's reasonable as well. You can choose a healthy caregiver, whether it's your spouse or someone else, to room in with the newborn, or we can provide that care. Our nursing staff will take care of the baby in a separate room. We're so happy that you've chosen to have your baby here with us at Women's Hospital. Rest assured, we're doing everything possible to make your experience safe and memorable during this pandemic. And if you have any questions, please don't hesitate to give us a call.